you would like this recorded, don't worry, this is all going to be recorded and put up on the YouTube channel for the IHA. If you're looking for past IHA lives, that is actually on our website. If you go to internationalhorsemanship.org, go to media, and then underneath you can see all the IHA lives that we've done. We've also done some in conjunction with the Bay Area Savvy Players, and there's been some very interesting presentations on those. Actually, next month, the Bay Area Savvy Players is supposed to have Linda Pirelli as their guest speaker, so make sure that you are able to come to that. And tonight we have our very special guest with us, Dr. Amanda Marsh. She is a veterinarian in Cody, Wyoming. She is one of my wonderful veterinarians, my favorite one, just so you know. She's the owner and operator of Prairie Summit Veterinary Services, and she studied veterinary medicine at Colorado State University. Dr. Marsh has been in private practice for 8 years, tailoring her practice to equine medicine, lameness, neonatology, and reproduction. She is also a certified veterinary acupuncturist. If you're looking for more information on Dr. Marsh, visit her website at drmarsh at prairiesummitvet.com, and we'll make sure that that is on our website link as well. And so Dr. Marsh is back. This is actually her second presentation because everyone loved her first one so much. And we had big aspirations, big goals for that first presentation. We had no clue what we would get through completely, but there was a big part of that presentation that we didn't get to, which was about worming and parasite control. And we had so much of a request for Dr. Marsh to come back that she kindly has agreed to do that tonight to see the second half of that seminar. So take it away, Dr. Marsh. And she's actually at her clinic right now.
Yeah, it's a little bit better than last time, which was in my truck while I was at Nutcracker practice. So we have a little bit better internet service this time, I think. So,
but you know, it's pretty incredible you were able to do that and also be able to go to your daughter's Nutcracker recital. So, you know, you make it work. And just so you know, everyone here attending tonight, if you have a question during the seminar, go ahead and type it in the chat. I'll try to present that to Dr. Marsh, and we will take time for questions at the end. So we're going from 6 to about 6:45, 6:50, and then we're going to entertain questions. And if we have time, I'll let you ask those questions yourself, or I can go ahead and read the questions for you. But if you have a question that comes up during the seminar, please type it in your group chat as we go along.
Okay. Well, tonight, I think, yeah, this was the second half of what we were going to talk about that evening. We were going to do like a whole spring upcoming wellness, but now we're kind of in the heat of things, I guess. April tends to be my busiest month here as far as vaccinations, deworming, teeth, those kind of things. And so kind of like I did in the last one, the presentation that I'm sharing, and hopefully it's popping up, I'm guessing that you guys can see it.
It looks perfect. Yep, we see.
Perfect. Is the presentation that is put out by AAP, which is my governing board, I guess. And the reason I really actually like this presentation is because it's actually more of a management presentation versus, I guess, more of a product guide, because I think that sometimes where we get stuck with internal parasites is just going out and seeing what is available to buy and just buying them and hoping that we get what we've got and kind of go from there. So we're going to kind of work our way through the presentation, and then I'll kind of interject some stuff that you know, maybe I see differently, or maybe could be viewed differently from area to area. In Wyoming, we're a little bit blessed. We have really cold temperatures, which in many cases will take care of some of our parasites. Your places that have really hot temperatures will also be very fortunate, because very hot temperatures actually decrease your parasite burden as well. So we do get a little bit lucky here, but we kind of try to stick to some of the the guidelines the AAP has set out. Things have changed significantly even since I was a young kid. When I was younger was really when rotational deworming was huge. So the rotation of, you know, deworming every 8 weeks with a different dewormer. So those horses were getting wormed 6 to 8 times, or dewormed 6 to 8 times a year. And as a profession, we've really went away from that. Probably when I was in high school was when the daily dewormers came out, and there's some pretty good evidence that maybe those are also not a very good approach either. So so we'll kind of start at the beginning and just cruise along and see where we get to. So
well, and if I may comment, one of the things I really respect about Dr. Marsh is she is going to present many sides of the story here. She's going to present what is generally recommended by the AACP board, and then she's also going to present a more holistic view, and when she feels like that is a, you know, a great approach, or when she feels like, okay, this animal really needs more you know, traditional approach. So keep those questions and type them in the chat as we go along if you have those.
Yeah, so kind of basically, especially from a veterinarian standpoint, I mean, kind of our goal is, you know, why do we intervene with certain things? And realistically with parasites, the reason why we intervene is that the biggest consequence on horses is really what we call ill thrift. So the horses that just don't do very well. And it can start out as just the kind of a dull horse and really kind of go all the way to colic. And I've seen some really bad cases. We don't see as many as we used to. Probably close to about 50 years ago was when the large strongyles were the reason why a lot of dewormers were created and why people started doing tube dewormer. And it was because horses were dying, having aneurysms due to large strongyles migrating in the blood system to the abdominal aorta, so the big vessels within the abdomen, and those horses would die of very severe fast colic because they literally would hemorrhage in their abdomen. And so that's kind of that's what started deworming, I guess, as a therapy. And so we luckily don't see that as rampantly as it was at that point. Luckily, we don't have to tube horses to deworm anymore. And some of that is because our products are better. Some of it is because we don't see large strongyles like we used to. I think I've seen one case of large strongyles since I've been in practice. So that's a good thing. But we still see these horses that either become so weak because they have a large parasite burden, and you'll especially see those horses in the Midwest. Seems to be the area of the country that has some of the worst parasite burdens because they don't have severe cold and they don't really have severe hot either, and they have a lot of lush green grass. So yeah, so I mean, it is rare to lose a horse to worms now, but it does happen, and I still see a case probably once every 6 months or so.
Mm-hmm. That's plenty.
Yeah,
we don't need more.
Yeah, and it's kind of, I mean, it's a blessing maybe, but I think at the same time we kind of get lulled into a little bit of false feeling of comfort and because parasites really do, they much like in third world countries with young children, they rob them of their valuable nutrients. And so that's why you get those horses, if they have a large parasite burden, their coat is really dull because they can't absorb the fatty acids from their feed to help their coat shine and help their skin have a good barrier. And so oftentimes those horses will get skin infections as well. They also start getting a pot-bellied appearance. And that is quite literally because their intestines actually are kind of thickened and swollen, and they kind of leaky, for a lack of a better term. They can also migrate, so they can migrate through the organs like the liver, lungs. Actually, we don't get very many lungworms, but they can be around. And I've actually seen one that actually migrated into a heart. So they do go into places where they're not supposed to be. And the term obstipation is just obstruction. So we can actually, especially in our younger foals, have parasites that will actually ball up and obstruct them from being able to, and they get severe colic. And I've been in on a couple colic surgeries where we took out large amounts of worms in yearlings. So they can actually become a physical obstruction. This is kind of just a general slide, you know. Parasite control, I see a lot of people who bring me thin horses, mostly to get their teeth done and get dewormed. Well, that's probably only 10 to 20% of the picture. Some of those horses are thin because maybe they don't have great feed, and they also don't have good water, good pasture, things like that. So especially as a veterinarian, when I'm looking at a horse, and you know, the first thing that jumps to mind is, oh, I should just deworm my horse and that'll make it better, or oh, I need to float their teeth and that'll make it better. Oftentimes with these cases, I'm looking at, yes, I'm looking at their fecal egg counts and stuff like that, but I'm also looking at their nutrition program, because sometimes there's holes in it all the way through. So this is kind of a cool overview, because I think a lot of us, and even sometimes I have to refresh myself on what each type of worm is, and kind of what they do. These are our what we will call our big four, that really cause intestinal issues in horses. So our small strongyles, or cyathostomes, I can't speak today, cyathostomes, they are our most prominent worm that we see. So when we look at fecals and fecal egg counts, they're going to be the most prominent thing we're looking at as far as trying to determine what kind of worm burden exists in your pastures or in your herd. Ascarids are what I see quite a bit, because I do a lot of reproduction and a lot of foals. Is ascarids are the parasite of young horses. So that less than 18 months of age horse that gets sick or really ill thrift or doesn't grow, ascarids tend to be the worm that we're looking at. Up here in our country, we have a lot of tapeworms. Tapeworms were probably overlooked for a long period of time as the culprit for chronic hair issues and just generalized weight loss. So almost on a daily basis, I see tapeworms on fecal floats. So pinworms are where that whole "my horse is scratching his tail out, I think he has worms" thing came from. And kind of, I see it in people come with dogs. If they have horses, they will come with their dogs and say, "My dog is scooting his butt, he must have worms." Well, that's not really the case in dogs. But in horses, not as much in our area. I mean, I do see them, but pinworms are actually the little tiny worms that set up shop right at the horse's rectum. And they can be really kind of awful little parasites, because they will make these poor horses just itch and scratch and actually make their tails bleed. Rarely do they have internal consequences, but they definitely can destroy a tail and make horses just really extremely uncomfortable.
So they actually live around the rectum. They're not living in the tail.
Right, they're living inside the edge of the rectum.
Okay.
And so they scratch trying to rub them out is what they're doing.
Got it.
These ones, these are kind of the other ones. I'm going to try to bring up a video. I have a kind of a cool video that I came across a couple years ago. Bots, we don't really think of it as a big deal. I mean, we see the little bot eggs on our horse's legs, and we kind of really think of them as an annoyance, I guess, more than anything. But bots can actually be ingested and set up shop in the stomach of horses. And so there's some thought that these, that more stomach ulcers might be due to these bot fly larvae than some of the other things that we have seen in the past. So let me see if I can bring it up because it's actually kind of cool. Let me see. I'm going to try to be really tech savvy here and see if I can do this.
You can unshare if you want.
At least you guys will see what's does a video pop up?
I think what you'll have to do is unshare.
Does that share? Does it show a video now?
Here, I'm going to help you out here. So I actually took it away from you. And so now I'm going to stop the share. Now I want you to hit share again, but before you click the screen at the bottom, make sure you say optimize for video. Okay, so okay. Hit the share.
Okay. Oh, there we go. I see you. Okay. There we go.
And it's starting to work. All right, and if you hit the larger button there, we got it.
Yeah, so this is actually a scope of a horse's stomach. And it was a horse with severe stomach ulcers. One that was, I believe had been treated with multiple rounds of GastroGuard, which we all know is extremely expensive. And with no real improvement. And this horse's almost 2/3 of his stomach are covered in bot fly larvae. So there's a lot of thought that maybe as a part of our approach to stomach ulcers might be deworming with something that will get rid of bot larvae, which luckily ivermectin does a pretty good job on. So this horse just hadn't seen it. It had seen like $1,000 worth of GastroGuard, but it hadn't really seen very much for dewormer. So, so it is a kind of a thing that we think is maybe a little overlooked.
Is there any way to test for those bot flies other than the scoping?
Other than scoping, no. Yeah, other than scoping, there's not much that we can do to actually rule them in or out. So, okay, let me see if I can get back. Okay, I don't know if I'm back. Am I back to my slides?
No, you might have to unshare.
Stop the share and come back again, right? There we go. Okay.
That was a great video, though.
It is kind of a cool video, and it even makes me kind of squirm a little bit too.
Yeah,
so.
I mean, I'm not saying it's not gross, but it definitely gets the point across.
Yeah, absolutely. Threadworms, neck threadworms, those I don't see. I honestly have never seen a case of them. I've seen pictures of them. They tend to migrate to the skin in different places. I know they definitely they're a little bit more of a third world parasite, but occasionally they crop up in the United States. Bloodworms are actually technically your large strongyles. So
can you get even closer? There. Is it sound?
Yeah.
Mm-hmm. There you go. There she blows. It's the cuterebral larva coming up to breathe through that breathing pore.
I'm not sure if that's a video that's playing in your background there, Amanda, because I don't see anyone that's unmuted.
Dr. Evans can explain the life cycle.
Oh, it must be.
Yeah, I think it's a video
Oops.
playing in the
Hold on.
background of your computer.
There she
I was like, oh,
blows.
okay, hold on.
Okay, now we're gonna.
I must, I was like, wow, that, oh yeah, there we go. We're gonna make it go away.
Okay.
Oh yeah, we're extracting bot flies in my background. There we go. Start again. I thought somebody was talking to me.
At first, but then they sounded very with a lot of medical terms. So.
Yeah, exactly. Okay, we're back. But yeah, bloodworms, luckily we don't see very much anymore because they were so devastating and we kind of took care of them. Some fear that they may come back if resistance becomes an issue more, but for right now, we don't have any resistance in bloodworms. Lungworms, they tend to be a little bit more south. Donkeys are actually the natural host for lungworms. So sometimes there is where they crop up in horse herds that actually have donkeys that come from the south and then come up and be a part of somebody's herd. So there we go. Life cycle, very basic, is there's eggs, then there's larvae, which are immature worms, and larvae are what actually dig their way into the walls of horses' intestines, and they're usually the part that's also ingested. So eggs usually live in the environment, they hatch into larvae, then they're ingested by horses, and then they grow to be adults within the horse. But larvae are really actually where we focus a lot of our attention to, because that's the most destructive stage of the parasite. This is kind of what I just said. They hatch and then horses swallow them when they graze. And actually while we really like to have our horses out on grass, which is a wonderful thing, but it truly is where they get most of their parasites from. Horses actually like, parasites actually like the little area within grass that's kind of about midway down the stem that's kind of moist, not too hot, not too cold, not a lot of sun, and they will actually live in there for some pretty extreme temperatures actually that you wouldn't think that they could live in. So that's why we can have parasites even until we get what we call a hard freeze. Or temperatures in excess of 100 degrees. So they're actually pretty darn hardy.
So is that saying that it's actually, as far as the parasites are concerned, if your horse is in a dry lot and you clean up all the manure in the dry lot, they're actually less likely to get worms than they are in a pasture?
Exactly.
Wow.
That is exactly right, because you can figure that your dirt, especially if you're removing the feces, or I mean, even if, like, as some people who have large dry lots and can't necessarily pick up all the feces, if they drag it, spread it out to where those larvae both dry up and are exposed to heat or extreme cold, do really, really well. You know, especially those larger herds of horses where they can't pick up all the poop every day, that is a good way to get it disseminated and dried out. But yeah, and it's also why a lot of people, especially back east where their worm burden is a little bit more, do mow their pastures a little bit more frequently. So decreasing or exposing that inner layer of grass to a little bit more of the element will decrease the amount of parasites that you have.
That's interesting. Just a little warning, Dr. Marsh, you have about 20 minutes and then we'll take about 10 minutes of questions. So just so you know.
Sounds good. Small strongyles, these are going to be the most important, mostly because these can be the most detrimental. These are the worms that we see the most of, but they're also the worms that like to creep into the walls of the intestines. And because of that, can be extremely hard for us to get rid of. And so these are ones that can make horses the sickest for the longest. They cause probably the most damage, weight loss, colitis, diarrhea, and in older horses, actually that edema that builds up on underneath their stomach that sometimes we see as a big kind of plaque underneath their bellies. So here we kind of start getting into why the parasite guidelines have changed, and probably the most important part is that we are starting to see resistance when using all of our different drugs that we use, and probably because we use them too frequently. When I came into practice, when I first got out of vet school, I came in and I noticed that almost 90% of the horse owners I interacted with would tell me that they just wormed with ivermectin, and that was the only thing they'd ever done. They hadn't implemented any kind of environmental change. They hadn't switched up and used any other medications. They haven't done it. I mean, the kind of the idea of a fecal was a little bit of a foreign phenomenon. And I think all of those kind of things is what has led to us getting less and less of an ability to kill worms. And I think where some of the importance of this talk is that there's so many ways to approach it where honestly our dewormers become, I mean, they're part of the plan, but they shouldn't be the only plan. And because I think that that is probably essential for people to understand is that, you know, I use a dewormer when I know I have a high parasite burden, and I know that we have also implemented everything else. You know, we have drug our pastures, we have done a fecal egg count so that we know exactly which horses are shedding and which horses aren't. So I'm targeting who I'm deworming versus just deworming everybody. So I think that that is where this talk is kind of a nice thing, is that it's not just deworm them and send them home. I think that we can do a better job by approaching it and then save some of these drugs for when we actually need them. I think that that is hugely important because they were so overused in the past that now we're getting to where there's parasites that don't care about our dewormers and therefore are going to be a really big problem in the future. Mm-hmm. Encysted strongyles, there's the ones that burrow up, and to this day moxidectin and fenbendazole or Panacur are the only ones that will get those. And sometimes I will deworm these horses with a Panacur power pack, and we will have a profound movement of parasites. Sometimes I have to actually be a little bit careful. I don't just throw power packs at everything, because if I have a poor, sick, old horse and I give him a power pack, there's a chance I could kill him. So, because I will have so many worms move at once that they do colic and they get extremely sick. Bloodworms, we kind of talked about. We don't have to do very much about them. These guys, foals, probably one thing that I can tell people to be extremely careful with is that ascarids in foals, if the biggest kicker is the reason that I'm really careful selecting dewormers is that in foals, you cannot use moxidectin or Quest or Quest Plus either, because they can produce such a profound migration of these ascarid roundworms that they will kill foals within 12 to 24 hours sometimes. So if anybody remembers anything, don't use Quest in your anything less than 2 years of age. And people do, because they go to Tractor Supply and they pick up a dewormer, and they just think that it would be good for everything, and it's just not. So
what do you use for your young horses?
I will use Panicure. I will use just straight up ivermectin, so either an Equimax or Zimectrin Gold, something like that. I use quite a bit of Pyrantel in the first little part of things on foals. And I kind of do tend to, I am also very careful. If you have foals, you need to be pretty, and you do deworm them, use the weight recommendation. I mean, sometimes when we're doing our big horses, we just give them the whole tube and we figure, well, some of it gets spit out, blah, blah, blah. With foals, be pretty accurate on your weight, because you don't want to overdose them and have them have a large amount of worms move at once. So,
well, that is very valuable information. And just for our information, Dr. Amanda, is there, do you have a document of the wormers that you generally recommend somewhere that we could post on the IHA? Or
I bet you I can totally get you that. Yeah, and I have a nice little one that kind of tells you which horses I use it in, when I use it, and what things, when to not use it, which I think is probably,
that would be wonderful, and that'll help the people here tonight taking notes and everything to know you don't have to write everything down. We will be posting that document as well, so thank you very much.
Absolutely. Tapeworms, like I said, I see a lot of it in my neck of the woods. I find that they are the biggest cause of some of the yucky hair coats, the horses that just don't shed out very well. So definitely, if you have one of those horses, especially if it's a younger to middle-aged horse, that's a really good thing. And to have your veterinarian look for is tapeworms. And the biggest kicker is when you're looking for tapeworms, they don't always show up in a fecal. And so multiple fecals, so multiple samples through the week. And also sometimes they have to be, like, if you're really suspicious that you have tapeworms, but they're not showing up in your fecals, sometimes we actually send them off to be centrifuged so that you kind of concentrate the parasites. So if you're really suspicious and you keep getting negative fecals back, then ask to send it off, which I'll just send it. I send mine to Colorado State and have them look if I'm really suspicious that I've got a problem. So yeah, praziquantel, Pyrantel kind of does tapeworms. I wouldn't say is good, but praziquantel is the drug of choice in tapeworms in all species, humans, dogs, cats, and horses. They recommend 1 to 2 times a year, but I think the biggest kicker is I like to find them on fecals if I can, to verify it. And I also, if a horse is on consistent pasture, they will come up positive for tapeworms intermittently all the time because they just get reinfected. So don't necessarily deworm your horse with something to cover tapeworms just because you find it. Make sure that, you know, they've got some sort of, they've got maybe some symptoms, or it's at least been 6 to 8 months before they were dewormed for them again, because like I said, they reinfect frequently. And it's probably not necessary that we deworm them every time to kill those tapeworms. Okay. Because I have had people come to me, well, I had a fecal last month somewhere else and it had tapeworms, so we dewormed, and I do another fecal and I find tapeworms, and they're like, okay, well, what do I need to deworm with again? No, I'm not going to get you any more dewormer. We're going to let him be for a while.
Mm-hmm. How long can it possibly take sometimes for that to take effect? I mean,
oh, as far as like the dewormer and stuff?
yes,
is that what you're asking, dear?
There was, you said you did a dewormer a month ago and then you wouldn't recommend doing it again because even if you did see those tapeworms. Yeah,
so usually the dewormer is pretty fast, but what can happen is within even 30 to 60 days, if they ingest another tapeworm from the environment, they can come up positive again in 30 days on a fecal. So kind of how I use it is I kind of try to look at it of when were they dewormed last, and then also how many do I see. If your horse was dewormed with something that covered tapeworms 30 days ago and I find one little tiny tapeworm on a fecal float, I'm not going to worry about it. If I find a ton, then that might be a different story. But those dewormers actually do act pretty darn fast. So,
okay. Thank you.
Lungworms, like I said, donkeys are supposed to be the natural host. We don't really ever see it they're more of a third world thing. There's those pinworms, the reason why horses rub themselves out. Ivermectin works pretty good. They say it's resistant to ivermectin. In our neck of the woods, when we have them, they're not. But a lot of people do also use moxidectin or Quest to get rid of these guys. Here's our bot flies, or bot larvae within the stomach that we kind of already talked about. These are the general signs: dull coat, pot belly, colic, slow growth. Those are pretty huge. So this is probably like the best take home thing. And I have actually an article that's really, it's very wordy, but I think it's a good one, and I'll try to share it with you, Farrah, so you can put it up on your website. It's the True Parasite Guidelines from AAEP. It's very long, but if you work your way through it, it starts to make sense. And it really has to hinge around, how do we determine how we deworm? And so fecal egg counts are really what they came up with to kind of help guide people decide how they are going to deworm on a farm, rather than going out and just buying, like you have 60 horses, going out and buying 60 tubes of Zimectrin Gold. What you kind of start to do is you start to, you look at how your horses are distributed. So how many horses do you have, in pasture A and pasture B and pasture C? And then you take samples from multiple horses within each of those areas that they're housed in. Because your goal is to find the horses that what we call are the high shedders. So horses tend to be either a low shedder, a medium shedder, or high shedder. So probably has to do with their immune system, has to do with age, things of that nature. But some horses just shed more eggs than others. And what you're trying to find are those horses, because if they get infected with a parasite, they are going to put more parasites out into the environment. And so that's what your goal is to find those horses. They will require more deworming because your goal is to reduce the amount of eggs that they put into the environment. There's going to be, I think the studies show only about 10 to 15% of horses are those high shedders. So the nice thing that shows is that maybe only 10 to 15% of our horses do we have to deworm aggressively. And so it's a much more strategic approach to deworming rather than just gross deworming of everything. Mm-hmm. I have one horse that I have never found parasites ever in her, ever. I mean, like, I know I've got them, but I never find them. And she probably is one of those low shedders. She, for whatever reason, whether she's got a great immune system or what she's got going on for her. But the nice thing is I know I can turn her out anywhere, and it's just not going to make, any difference. The other thing it can show you is if you have a bunch of high shedders, you probably don't necessarily want to house them together. because then you're going to end up with a pasture that has a huge egg burden. And therefore anything you introduce to that pasture is probably going to get parasites. So
that's a
yeah,
very
so that's kind of,
I never thought about that.
how yeah, it's kind of an interesting approach, and you definitely, when you do fecal egg counts, you want to get somebody, either send them off or find a clinic that is very comfortable with them. A lot of us send them out just because we don't have the time to do them in clinic, in all honesty. So when you're doing fecal egg counts, you want multiple horses from each of your housing situations, okay? And you want to refrigerate your sample. We don't want it any older than 7 days, and it needs to get to the lab within 7 days as well. So a lot of our samples are either overnighted or second day aired on ice, because if it freezes, those eggs will burst and they just look like debris on the slide. So we can't really get a good idea of what they are. I brought up that article on my other computer I have. Realistically, as fresh as possible. If you can catch it right out of the horse, that's even better. And definitely
black bag holding it open.
Sorry.
Holding
yeah,
your
exactly. Exactly. And especially if you're in a dry let situation, those piles of manure dry out really fast, especially in the summertime. And so if you're especially on a dry lot, you want to collect those samples as quickly as possible. Okay.
I had a question about fecal egg counts, referring to my father's horse that he bought from Texas. I think you remember that.
Yep.
He actually, the first horse that he bought from Texas died of colic from the small strong isles that actually, he was wormed, and then I think it took almost 6 months for those worms to diffuse out through the body, and then they were trapped inside the blood vessel that fed the intestines, and then he actually colicked from lack of circulation. But the second, so the second horse, the breeders were paranoid about it, and they wormed the horse. We got him here. We immediately did the fecal egg count, and it was 0. There was nothing in it. However, I think I went traveling and came back a month later and still noticed that this horse has diarrhea. And I called you. I told my parents this is not okay. He still has diarrhea. And we called you, and you said, had you done the fecal egg count? We said, yes, it was negative. There was nothing there. You said, well, let's test for other things, but let's just do one more. And you found the results that he was full of worms. And that was, can you just explain a little bit about the shedding and how that?
Yeah, exactly. And so, that sometimes when you do fecal egg counts, you hit them in a time when they aren't shedding. So that's also one thing. So a lot of places who do fecal egg counts do them on a fairly frequent basis, especially when they're first setting up their program, because some places will actually not do this more than like once every couple of years, because they're trying to design something that maybe is a good representation without making huge costs. But you do sometimes have to take multiple samples. The other thing that can happen is some of those encysted larvae will break open and they will migrate. And so then your fecal egg counts will climb up. And the other thing is that stress, actually. So maybe the stress of being shipped or a new surroundings or things of that nature also make those encysted larvae come out, because probably I guess the immune system of the gut is not as good. So that would probably be the most likely thought of why some of these horses, kind of like with viruses and stuff, why they become more apparent after changes in their surroundings and different situations. But sometimes I've tested them and they'll be 0, and then I test them 2 or 3 weeks later and I find quite a few. So yeah.
So what do you recommend as a, to get a for sure, or at least as best as you can, result of the fecal egg count? Would you test them and wait a week and then retest, and then you'd have a more accurate view?
I think that you probably wait just a smidgen longer. Probably test once and then recheck again in probably 30 days. Unless you have a horse that's clinical, maybe you would recheck quicker. But to allow for the life cycle of larvae to kind of progress within horses, sometimes 30 days is a better representation of what's going on. It can make it hard to wait. I mean, because I think if you get, and I think that's probably the caveat, is if you get a really small fecal egg count when you first start, definitely retesting is a great idea. If you get pretty high numbers right off the bat, then I think you can probably feel fairly confident that you have a worm burden you need to deal with.
Right. Makes sense.
Yeah. But yeah, I think if you get really, especially you get multiple horses that are really low, I think retesting again in 30 days is a great idea.
Okay.
And then I think if you get another negative or a low count again off of multiple horses, then I feel like you probably have a good program in place. I have quite a few places around here that actually are sitting in that boat where, multiple egg counts, maybe 2 or 3 in a year, coming up really, really low, maybe 1 or 2 horses out of 30 that will have any kind of shedding. And what we do is we deworm the horses that are housed with them and then housed in the surrounding pastures, like really close. And then the other horses we leave alone. And it has worked darn well for the last 4 or 5 years now. So
that's fabulous news. That's completely different from what the recommendations were before. So it's 10 till the hour just now. I know you have a few more things to go through, but I know that we probably have some questions coming up here too. So I'll let you.
Yeah, I think these last few slides are pretty darn quick. I think we kind of talked about this, basically working with your veterinarian to discern what kind of deworming program you need. Of these 3 things, I only use the paste syringe. I don't use daily dewormer. Probably even for the fact that I don't know that it needs to be fed every day, but also for the fact that I have done plenty of fecals on horses that are on daily dewormer and seen lots of parasites. So I guess I'm just not convinced that it does anything. And nasogastric tube, luckily we don't have to tube horses. I do see some old guys who still do it. It just seems like a lot of work. So I don't, it doesn't yield any better results. So we just don't do it anymore. This is kind of environmental, basically don't overgraze. Get rid of your manure. Composting works really nice. If you want to spread your manure on your pasture, is compost it first and then take it and spread it, because it does allow for high enough temperatures to kill parasites. So I do have quite a few clients that actually do that around here, which is kind of cool. And mow your pastures. So yeah, I think that's basically the presentation in and of itself. And I will get you guys this, like I said, very long paper, but I do think it's a good one to work through, and will make sense if you take it a little bit at a time. So I will get that to Farrah.
That'd be wonderful. And we'd also welcome an article of your summation of that information in the IHA magazine, if you'd be willing to do something like that.
Yeah, absolutely.
And so I have a question about natural worming methods. So
Yep.
there's different things out there. Diatomaceous earth. I don't know if you have an opinion on that, or there's also herbal wormers.
Yep.
Have you found anything that works specifically well or doesn't work as well?
I think that diatomaceous earth has been the one thing that there has been some pretty good research that it works on. I use it on my chickens quite frequently, but we do know that especially in conjunction with fecal egg counts and deworming some of those high shedders, that diatomaceous earth probably works really nice at decreasing just the overall worm burden within a program. So some of those horses that are going to shed a ton, it's probably not going to work as well. But in a big broad spectrum, yes, I think that it actually has a really good place. Some of the herbal wormers, I think some of them hold some really good, you know, I haven't used a ton of them. I will tell you, I brought up like on my other computer, some people actually use a lot of, like, will use sand clear, so your psyllium hull, in thoughts that an increased fiber in those horses' diets will actually move through parasites a little bit quicker. I think it probably works a little bit. Probably not as good as we would hope, but it also removes sand, so I guess you kind of kill two birds with one stone, you know. There is some Chinese herbs that that I have used in the past. They kind of focus on general immune system within the gut, in hopes that making that immune system a little bit better, so that maybe it's not such a great environment for parasites. And so sometimes, especially if I have a horse that is pretty weak and I'm afraid that, like, I'd love to hit him with a power pack because I know that he's got a lot of worms, but I'm terribly afraid to hurt him. Sometimes I'll start him on something like diatomaceous earth, and then and you know, do some of the easy things that might decrease the worm burden before I hit him with a power pack, because it seems to, you know, kind of ease them into getting into a better deworming program.
Like, yeah,
So
less traumatic experience for the horse.
Yeah. So a little bit easier on them.
I did have one question on threadworms as well. I know you said they're not common in this area, or the neck threadworms, but I had one of my students had small patches of skin. It almost looked like spot coming off on her horse's back, and it wasn't even just her back. It was like different areas on top of the horse's top line, and it really looks like you know, like a fly bite almost, like all the, but it was pussy, all of the skin, you know, and the hair came off, and a bit of the skin, there was like a little red patch there, and they were all scattered along the horse. And I think Wesley had, especially in the mane, oozing. So were you under the impression that those were a type of neck threadworm, or?
I do remember that, and I think what we were, I think they could be. They tend to be extremely circular. The like two cases that I really felt really confident of. I see more funguses than I do threadworms, and so and especially like gross, like ones that develop a lot of pus for whatever reason. I get a lot of funguses around here that do that. So I think it's a possibility. I just don't think that we see it nearly as much, I guess. I think that the Midwest, a ton. I think that when I was at Tennessee Equine, they had quite a few of those horses get threadworms and neckworms. And I don't really, I mean, like I said, I don't know a lot about them, but I definitely think that maybe our environment, I think they are, if I'm remembering correctly, they are a little bit more susceptible to cold than some of the parasites are.
Well, and I
So,
think this happened when it was kind of weird, humid temperatures here.
yeah,
Unusual temperatures. So
yeah, that year we had a lot of moisture in May.
yes.
Yeah, yeah, because I think they get them a lot in Kentucky, Virginia, those kinds of places is where, at least you always see them pop up on like Haggard's News or Root and Riddle or something like that, and more probably because they see them a little bit more.
Okay. Well, thank you for that. There's a few comments, and if you have enjoyed this seminar tonight by Dr. Marsh, please leave some comments in the Zoom chat if you have not already. There's a comment from Lisa Rask. So she says, so it isn't about necessarily killing all of the parasites, but just keeping them at manageable levels that aren't detrimental to the horse's well-being. Would you agree with that, Dr. Marsh?
I would absolutely agree with that. Yeah, because there is absolutely no way that we would ever get rid of them. And so it's this intricate balance of clinical signs, how much of a burden that you have, and what your management approach is. For me, sometimes I've got people that I know they're not going to clean out their pens, and I know that these horses are going to get persistently reinfected. And so sometimes the only thing that I can get them to do or what is to just deworm their horses. And those are kind of hard. But I know I will never get their environment rid of them. So in my well-managed places, our goal is to just decrease it as much as possible and know that we're always going to have a positive at some point.
Mm-hmm. Well, it's a realistic view.
Yeah.
And just for a quick recommendation for everyone out there, and again, we are going to have a sheet that goes through, but at this point, what would you tell all of the people out there? Test fecal egg counts about how many times a year, and then yes.
Yeah, probably, I mean, at very minimum, once a year. I think probably the people who do it once every 4 to 6 months have a pretty darn good idea about what's going on.
Mm-hmm.
And I think if you can reproducibly show for a couple years in a row that you continue to have low fecal egg counts, then I think you can, maybe back it off a little bit, come back and only do it once a year or something like that. But I think you have to reproducibly show that with your management, like with your environment, and with your fecal egg counts remaining low, that you want to do that for a couple of years before you feel really comfortable backing off on things, I guess, as far as testing.
And then as far as trying herbal warmers, if you have a fecal egg count before, you try your herbal remedy, and then you have it's much lower the next time, then yay, you never had to do it.
Yeah, absolutely.
So
absolutely.
I think it's an excellent approach. So Ada says, thank you so much for this. I feel like there's no winning with parasites. Too much warmer makes resistant worms, and fecal tests are not always accurate. It's very hard to hear. Helpful to hear the rundown. Thank you for being so honest. It was awesome. Thanks. Lisa says, love this so much. Thank you, Dr. Marsh. Sarah Lee says, thank you. It's very interesting. Public service announcement, do not eat your horse's ivermectin in the lab. Yes. Please do not eat it, and then do not eat it or fish tank cleaner. Thank you very much, Karen. Has been some thought about that. Susan asked, do you recommend harrowing the pastures, at least dragging them, right?
Yeah, so that it's a little, the one slide here does talk about probably the best approach. I do see some people, and I've been like guilty of it as well, going out and just right before grass starts growing, just spreading your manure and dragging it and spreading it all out. The biggest kicker is if you have a lot of old dead grass that's pretty tall and you just drag the manure into it, you probably just set up a good shot for those worms to grow or live. So dragging alone, if you have a very short grass or dead grass, is probably okay, because you do allow for a lot of drying there. But if you're just spreading it on top of grass that's taller, it's not going to be as effective as you might hope. So a lot of people will mow and then drag. So that's an option too.
Oh, that's excellent information. Jill Caldwell says, yes, great. Just got the end. Thank you. Robin says, very informative. Thank you. Jill Holmes says, thank you so much, Dr. Marsh. Fabulous advice, extremely practical. I have been pushing fecal egg counts for 20 years, and a few more folks in the Appalachia are doing this. This is from Jill Holmes, DMV. So just so you know, nice compliment from her. Pam says, great information. In the case of horses that end up having adverse reactions to some deworming products. My horse is okay with ivermectin, but not okay with Quest Plus. Can the stronger products be administered over a couple of days, or does it have to be one big dose to be effective?
I think that there's enough dewormers out there that I guess I'd probably stay away from it if they do seem to. And there's probably more, I mean, there's more people that will say that Quest as a product alone has had more reactions than others. And I think clinically I would agree with that. So in all honesty, even like, I don't know that I feel that it's probably as effective because it is really a little bit dose dependent. So I guess I'd probably just move away from that one. You know, we know that that moxidectin and fenbendazole have very similar approach. I mean, they're not definitely not in the same drug category, but some of the things that are susceptible to moxidectin are also susceptible to fenbendazole or Panacur. So I guess I just switch classes completely and just stay away from moxidectin in general is what I would do. Because we do have things, and we do see it in dogs too, animals that are more susceptible to issues with one particular dewormer.
Okay, thank you very much. Pam says, okay, thank you. Also here in Canada, the advice I had received about diatomaceous earth is to always feed it moist, as the angular nature can be problematic to respiratory. Is that something that you would agree with?
That's probably it. Yeah, I mean, especially, yeah, I think probably the kind of the dusty-ish nature, like when I take mine out with my chickens and stuff, I try to not just aerosolize it when I give it to them. Unless I'm in a hurry, but no, I think that that's probably not a bad idea. I never actually have, but I could see where, especially if you're feeding them in a bucket where their nose is down in it and it kind of puffs up, you know, it gets aerosolized a little bit more. I could see where that would be a great idea.
Yeah, she said she had a horse bleed from the nose from it, so that's why she ended up doing it. Lisa Rask has one more question. If my large farm doesn't run fecals, what is the best approach for my one horse?
I think it, I mean, I think if you do it on your own horse, a little bit maybe more frequent basis, you know, maybe every 3 months or so for the first couple of years, just kind of see where your horse is at. And then it depends on how they're housed too. You know, if they're out on the pasture, then there's a good chance they're getting reinfected, especially if they're not necessarily, it depends on what their deworming approach is, I guess. If they're really aggressive with a lot of dewormers, then your parasite burden might not be very high. It just might be unfortunate that those horses are getting dewormed a little too much. So I would do fecal egg counts on my own horse is probably what I would do.
Mhm. Well, I think that sounds like great advice. Well, thank you so much. Yeah, I think it'd be a good idea what Lisa said. Lisa said 2 to 3 horses on an overgrazed pasture, about 40 horses on the property, deworm twice a year. At least doing her own fecal egg counts is going to give her an idea of what
Yeah.
her personal horse is going through. So, well,
Yeah.
thank you so much, Dr. Marsh. This was very useful, very informative. Thank you for presenting both sides of the story and helping us really, I mean, actually, this was a huge relief because I was still under the impression that, worming every 2 months was kind of an expected thing everywhere. So it's
Mhm.
great to see that people are starting to have a different approach to that. So thank you
Yep.
again. And let's try to work out something in the future when you do your other presentations that we can record those and make them available to IHA.
Absolutely.
All right. Thanks a lot,
We would
everyone.
love to.
Have a great night.
Thanks. Mhm.